Welcome to Chapter 7. Halfway there, guys. Halfway there. We continue our discussion on the surgeries on the digestive system. For this chapter, we focus on the stomach. Let's begin. Do you still remember the different regions of the stomach? Can you name the structures that are pointed? Note, one of them is not a part of the stomach. I will give you 30 seconds. I think that is enough. So, let's start with number 1. What region of the stomach is that? That would be clue. This is the proximal part of the duodenum. So, this part is the pylorus, correct. Now, this part here is not a part of the stomach. That is quite easy. Esophagus. Now, the third would be the direct region of the stomach that is in contact with the esophagus would be the cardia. As we go down, this big part here, this is not pointing to the vessel. The region of the stomach, that would be the fundus. And the last one, which would be almost 1/3 of the stomach, would be the body, or sometimes we call it the antrum, correct. So the stomach is a musculoglandular organ interposed between the esophagus and the small intestine. The stomach again is divided into 4 regions. The cardia is the most anterior portion, wherein the esophagus empties to, followed by the short fundus, and then the body or the antrum, and the pylorus, which connects the stomach to the duodenum. The pylorus contains the pyloric sphincter. The stomach is positioned transversely and left of the median plane. It is found caudal to the left liver lobes, wherein the stomach has left an impression on. It is positioned very closely to the spleen, right here, and carries a part of the head and the body of the pancreas. Due to its large size, it has various sources of blood supply, depending on what specific surface of the stomach. The lesser curvature, right here, is supplied by the left and right gastric arteries, while the greater curvature is supplied by the left and right gastroepiploic arteries. There are 2 gastric surgeries which are commonly done, and we are going to discuss them in this chapter. The first is gastropexy, which is the permanent fixation of the stomach to the body wall. This is indicated as the surgical correction of gastric dilatation and volvulus. The other surgery is gastrotomy, which is the creation of a surgical incision through the stomach wall into the lumen, and is usually indicated for foreign body removals. So click on the link to the next video so that we could officially start discussing these surgeries.